Pfizer also announced this week that its coronavirus vaccine is safe and effective in low doses in children ages 5 to 11. But a question looms. Will the hesitancy we've seen in adults carry over to their kids? Uptake among older children has lagged, and polling indicates reservations among a significant number of parents. And the ongoing debate has pitted family members in some cases against each other across the U.S., including the family of Melissa Fallon. She and her husband have decided not to vaccinate their children, but Melissa's ex and the father of her oldest daughter, Aubrey, says he wants her to get the shot. That case has now gone before the judge, and the judge sided with Aubrey's dad. Mother Melissa Fallon joins us now. Melissa, thanks for the time. This is an interesting story that we've all been talking about this afternoon. You have 50-50 custody, which means, I guess, in general, that you have an equal say in what happens with your daughter. What did the judge say about her decision and siding with your ex?
Well, before the court date, she let me know that she was pro-vaccine. So I really felt like I didn't have a fighting chance. We went to court and I had a doctor's note, and the doctor's note did state that the American Pediatric Association does recommend children 12 and older to get the vaccine. Right. But he did note that he wanted Aubrey's opinion to be taken into consideration, and Aubrey does not want the shot. She'll be 14 in October. And the judge kind of just, I feel like pushed that aside and made her judgment.
Why doesn't your daughter want the shot, Melissa?
I think a number of reasons. For one, I had cancer at a very young age, 30 years old, and my girls are extremely high risk. So we don't know what the side effects in the future come from the shot, and she knows quite a few friends that have had COVID that have been just fine and built up their own immunities, and it's her choice ultimately, and I feel like she should have a say, and and her choice should be heard.
Is that why you haven't gotten the vaccine, because of your cancer?
No, I haven't got the vaccine because I have faith in my own body's immunities, and I don't agree with the shot.
So if this were a custody decision, Melissa, in court, you have to live by the judge's decision, right? I mean, how is this different?
Well, I have 30 days to appeal this. So I've been calling all around for lawyers, but because I do live in California and most of the lawyers are pro-vaccine, nobody will take my case. So I've been having an extremely hard time finding someone to help me just even appeal this.
All right, let's listen to one of the nation's top pediatricians. She actually testified before a House committee hearing and talked about the vaccine. We'll get your comment after.
Okay.
We do believe that these vaccines are safe, that the process to bring them to approval, even under emergency use authorization, is a very rigorous process. Nobody wants to put a child at risk. So we believe in the safety of these vaccines for all children when they're ready.
When they're ready, Melissa, what does that mean to you? And does that ease your concern at all for your daughter?
No, not at all. When they're ready, does that mean that they get to choose when they're ready? Or, again, is it us parents getting to decide for them? The FDA has approved many things before and had to recall them, whether we ingest them or have them injected. And I'm just not comfortable putting something in her body that we can never take back.
If this decision stands, will you get her vaccinated?
No, I won't be the one taking her. If it does stand, I will fight my hardest. I'm still looking for a lawyer, and if it comes down to it, then her father, my ex, will be the one taking her. I will not take her. She doesn't want it.
Melissa Fallon, thank you for your time. We appreciate you joining us and talking about the case.
Thank you, guys.
We want to bring in now, attorney Wendy Patrick. Wendy, this is certainly an unusual case, and it's interesting on a number of levels. Where do you come down on it?
I'll tell you, it's interesting on a number of levels because of its novelty. I mean, we've never been talking about this before. There isn't the type of COVID pandemic precedent that we wish we had to look at for guidance. So what you're talking about here, we're not talking about what we usually talk about: no shot, no salary, no shot, no syllabus, vaccinations in employment settings and educational settings. We're just talking about a mandatory vaccination. That is very different. That's new territory in a sense. There have been a few decisions that have come down around the country that have tried to mandate different people taking the vaccine. Bail is one of them, where you have a judge saying, all right, if I'm going to let somebody out on bail, they have to be vaccinated. Or occasionally child custody, but that's for a parent. But some of those have been reversed, so there isn't solid precedent of the sort that we'd like to have to figure out how this is going to shake out.
Yeah.
And it breaks my heart that you have a young lady that doesn't want the vaccine. So, and it is true that judges do want to take into account the wishes of everyone involved, including the child.
Yeah, this is an interesting case because I think a lot of people can see both sides of it. But what if you had a married couple, Wendy? How would that be different?
Well, I don't know that it would be different. You have a father and you have a mother, and sure, they have shared custody, but when you have one saying one thing, wishing one thing, and one another, and then the child having the same wishes as the mother, you know, it's a case of first impression in the COVID era. Now, we can analogize it to other decisions that courts have to make, where you have one parent wanting something and the other something else. But when it comes to vaccinations, courts really want to have everything be very narrowly tailored. They are looking, at least some of the arguments, the COVID vaccine for kids might be closer to the flu than to smallpox. Everybody is citing that case from 1905, which does have precedential value, but can be really distinguished over the years by what population we're talking about and who's ordering it. It's not a local municipality. In this case, it's a judge. So there is so much for lawyers to work with, and I'm confident that they will.
Yeah, it is interesting, too, because I guess in most cases, to your point, you're talking about custody, how much time one gets, property, things like that. But this is, it's a health issue. It's a vaccination that I guess parents normally would make the decision on.
That's true. And in the era of the Delta variant, younger, sicker, quicker, this is an argument that has gained steam over the last several months, is to what extent do parents have the right to make these types of decisions? Now, I know that there's lots we could talk about politically. Well, why aren't we forcing, people coming across the border to get vaccinated? I mean, there's lots of political arguments we could make, but keeping it in the context of the family, that's significant. And that is an area where a judge really does have to weigh all the equities you pointed out, the values of the mother versus the father, and the young lady involved as well.
It's a tough case. Wendy, Patrick, thanks for coming on and talking with us about it. We appreciate it.